Actually, when I returned from UK, that was the time I was posted in PG and I was asked to develop into a postgraduate institute. So there's a lot of problem because you have to go through the health department. But anyway, slowly we started the work. And take for instance, we had to develop a nephrology, kidney disease unit. And there should be also dialysis. At that time, Calcutta didn't have any center like dialysis. But Delhi had a center where the Professor Ahuja was in charge, Professor Ahuja. So I spoke to him. So he didn't care too much. हो जाएगा, हम कर देगा, something like that. It didn't happen for about a month. So I spoke to the principal, the director of the institute. Dr. Week was the director. Ahuja agreed, and that's how I sent Dr. Joyanta Bose. That's how I sent to Delhi for dialysis and kidney disease. It is in this fashion that we develop one by one all the departments. Diabetes, at that time Bombay was going far ahead with diabetes. They are the Diabetic Association of India. But one friend of mine told me, why not in Calcutta also you started Diabetic Association. One of my doctors who was in charge to notify every diabetic patient, everything. We are collected about, he had a big chart which contained about 86 at that time patients, all diabetes, all the information. So it is in this way it was developed, and the cardiology was developed because of, as I said, the doctor who initially worked under Dr. B.C. Rai in Carmichael Medical College, Dr. Gupta. He was posted in cardiology. So I gradually came in contact with him, and the cardiology department slowly became more and more popular. So at that time I was to him, the secretary was Mr. Sen, and his wife has hypothyroidism, thyroid disease. So I used to look after her. So I was known to the health secretary. So I went to him and told him a postgraduate institute, there is no chest department. So what do you want to do? The PWD has told me in 7 lakhs rupees they can make a building. In this way, cardiology, pathology, cardiology, then your chest department, medical department, everything started functioning very well. And the volume of work also increased. Patients started coming, and you can now see the position in SSKM Hospital, how popular and how crowded it is now. About this book, I have been told that it is the history of about 100 doctors, past and present, stalwarts in medicine, all have been described. And it is the foundation, Hepat Liver Foundation has done a good job to bring all these doctors in one book. So at least the present generation or the future generation will be able to know who is who and what he did contribute to the medicine. So this will be very reference book for future. And I think in the future we will have some research institutions which will do only research work, nothing else. It is possible, but it is a matter related to money. The research has just begun in India also, and many future students in medicine will be attracted towards this field. So far, doctors only got their degree to practice and earn money. The tendency was there, you see, but now that tendency is broken. It's changing. Therefore, for future doctors will have a big field apart from practice. That is one department, but research wing is another department. That is also a very famous. Research is going everywhere. So I think the future generation of doctors, they should not only think of passing medicine and doing practice. They should definitely give more time to research also, join research wing here or abroad. That is also in the long run, it will be quite informative, quite paying for them. I think that is the only way that we can progress further. Otherwise, it will be like what happened before the independence. Same thing will continue.